Hello, everyone, and welcome to this audio podcast. This audio podcast, as part of a quantum edition. This audio podcast, as part of a Vortux Gauntlet. This audio podcast, as part of a Lobostic sequence, and this audio podcast as part of a Storm Lobostics production. In this audio podcast, a look at works from 2015, a research poster presentation in a research poster presentation outlining in regard to electronic patient records, or EPRs, library services and multidisciplinary team meetings, or MDT meetings, and I look at sort of I look at these aspects. I look at these aspects in context of primary in context of primary care, aspects of primary care practices, but also in regard to healthcare services. This research poster presentation was part of and formed one of the another one of the research poster presentations as part of the healthcare awareness event that took place in the southwest region of the United Kingdom in around 2014. And the research poster presentation was collaborative, in that there was the collaboration involved two primary care physicians, and involved the collaboration with the renal patient with it involved a collaboration with the Renal Patient Support Group, the RPSG, in as part of this, works from 2014, 2015. The research poster presentation, as part of the research poster presentation, that sort of in around the same time, there formed a sort of a book chapter publication that had been published in as part of a publication in around 2014, 2015, sort of in around 2014, 2015, around in at the same sort of time, However, in this in as part of this audio podcast, and around this sort of audio podcast, a look at this works. I look at this sort of works from a sort of collaborative perspective, and again, in regard to the three sort of aspects: electronic patient records, library services, and multidisciplinary team meetings, MDT meetings. So to begin with, some aims. So the objective of this works was, number one, to highlight the importance of integrating general practice services, electronic patient records, and library services. Number two, to explore or to investigate the to explore or investigate why it is sort of advantageous to implement patient-centric multidisciplinary team meetings, MDT meetings in primary care, and to use the social media platform, the RPSG, to inform of some basic understanding in regard to the in regard to the entities. So a little bit of background, a little bit of background around this. So healthcare service users account for in around 50% of general practitioner appointments, 64% of outpatient appointments, and in around 70% of in around 70% of hospital admissions, according to literature from the Department of Health, and around 70% of total health and health and care expenditure in the United Kingdom is or has attributed to people with long-standing conditions, and people diagnosed with long-standing conditions are perhaps, at least where literature is it has evidence, is perhaps the most are the most have been referred to, sorry, as in the literature as the most in sort of intense users of healthcare and healthcare services. And between 2010 and 2030, it has been postulated that the number of younger adults with disabilities aged age 18 to 64 will increase in around just over 32%, from around 220,000 to around 290,000, and the number of younger adults with physical or sensory impairments by 7.5%, from almost 2,900,000 to 3,100,000, according to literature from authors in 2011. An estimated 15 million people. 15 million people in the United Kingdom have at least one long-standing condition, with the prevalence of cancers, chronic kidney disease or CKD, quickly increasing or quickly rising. This consequently has had some impact on access to lives, broader services and healthcare impacts more generally. Already, the 30% of the population with long-standing conditions account for a 70% of and in regard to NHS or National Health Service National Health Service National Health Service National Health Service accountabilities, and reducing the public's in literature has been evidenced that in at least some part, that reducing the public's dependence on healthcare professionals and increasing and increasing sense of well-being is and has been perhaps a more academic way of of a more of an academic way of healthcare services, or of healthcare services being uh, being uh, being linked to healthcare service users in a more in a more in somewhat more of more of a effective an effective or in part of a part of an effective way. Despite overwhelming evidence, patients or healthcare service users also face several difficulties or challenges. So in amongst the literature, there have been some aspects of some aspects of sort of some aspects of disparity in context of how authors have documented or documented or evidenced healthcare services linked to different healthcare services, number one, and healthcare services and healthcare conditions being number two. Now, in looking at within this research poster presentation, the issue with sort of current practice So so uh, although research has provided sort of valuable insights into the way patients or healthcare service users utilize services, it is difficult to determine the precise sort of understanding of of uh, of in, such information across different illnesses. It is important to gain a better understanding into the type of stresses, for example, experienced by patients, healthcare services suffering from different diseases or conditions, as information on the nature of disease related stresses may contribute to a better understanding of healthcare service users and sort of and amongst the general population or general public. So by implementing a sort of integrated some aspects of integrated healthcare services in amongst primary care and improving healthcare experiences, this can improve well-being and progress general healthcare can and progress general healthcare. um, Understanding how patients and the public access information in some regard is also important, considering many may feel less positive about own competencies, with some who may feel inadequately prepared about healthcare, and this places them at higher risk higher risk of poor healthcare when compared to those amongst the population, and amongst the general population, and amongst those without the same and or similar complexities. There needs to be a sort of broader access to to knowledge and understanding, such as directories with information leaflets, documents, books, and helpful contacts and sources or to information that can support patients and general public on the most important elements of health and healthcare. This cannot be achieved through just healthcare service users and patients accessing medical records. There has been literature amongst the evidence to inform that when patients or healthcare services have access to their healthcare records electronically, this has uh, this has advantages, and not to disrepute just not to disrepute, but where this research poster presentation sort of to informs and to highlight that 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 through that alone patients or healthcare service users cannot 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 sort of get the or have the best use of healthcare services by and through accessing electronic patient records in solo. And so the issue with current practices, or in amongst sort of current practices, and in amongst sort of primary care, and in amongst sort of secondary care, is that there is a lack of integration, not only between the sectors of healthcare, but also between sectors between primary care between primary care and integration and secondary care and secondary care and integration. This the poster presentation, we're going to now look at aspects of healthcare in line to health literacy. So the use of the internet and social media does not suit everyone. However, in contrast to 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 in contrast sorry in contrast to some aspects of the background here, healthcare service users whose first language, for example, may well not be English, for example, and approaching more and approaching more sort of modalities in regard to health literacy is and will be challenging or complex, or complex. So health literacy is predominantly, or has been evidenced amongst the literature as predominantly a skills based construct, that does not include sort of particular or specific motivational elements, and using different modes to improve health literacy alone to determine the needs of healthcare service users, and simplifying for them as a result, may be a hindrance maybe a hindrance hindrance maybe a hindrance and thus affecting healthcare service users, and the sort of healthcare professional rapport that healthcare service users would have with their healthcare their healthcare service teams or healthcare service providers. So as such, a patient or healthcare service user may gain some of the understanding, however, does not does may not have may not may not may not for example have or want the mindset to take action to take action in sort of subsequently. So works by an author in works from 2014 informed that what can be learned from patients or healthcare services living with particular conditions such as musculoskeletal. Healthcare professionals and carers healthcare professionals and carers in regard to the concepts around health literacy. In regard to the concept around health literacy, where where the investigator or where the author and the investigator looked at the use of looked at implementing a sort of a qualitative methodology to identify what can be learned from patients living with chronic musculoskeletal conditions, for example. And the investigator and team informed that patients desire sort of a predictable interactions and search for more not for more and search for more than not a knowledge and empowerment and responsibility from and a sense of a responsibility a sense of responsibility from their healthcare service providers. And it is important to inform and inform and inform healthcare service users from all healthcare service users and sort of patients from all walks of life in regard to ensuring that there are well designed information materials that are given that are provided and appropriately by by healthcare service providers or healthcare professionals whom are from and from within the varying healthcare sort of healthcare backgrounds. Importantly, at the same time, more evidence has shed light that people with a sort of low levels of health literacy tend to defer to healthcare professionals to make decisions for them and also tend to have less positive health outcomes than amongst people whom are more actively involved in aspects of health in aspects of healthcare health and health in aspects of healthcare. So now looking at some aspects of electronic patient records or EPRs. There is compelling evidence that patients or healthcare service users who are active in who are active or in aspects of healthcare in amongst in aspects of healthcare services, accessing healthcare records may have better outcomes than those whom are passive service recipients. The commitment made by the Department of Health in amongst primary care or in amongst primary care in 2015 was in regard to electronic patient records or EPRs were of two specific aspects. Number one, all practices or all primary care practices will be or would be expected to make available electronic patient record and cancelling of appointments, ordering of prescriptions and communication with general practice. And number two, where the Royal College of General Practitioners had agreed to take forward this work and through a particular and specific guideline referred to as patient online roadmap, which highlighted some important principles. Um, the there is evidence that this can improve or could improve healthcare service users and carers' understanding and level of participation, as well as skills and confidence to self-manage and leading to better health and healthcare outcomes. There thus needs there thus is or has been a requirement to see that patients, healthcare service users, sort of come together to provide more to see that there is a sort of more awareness in context of electronic patient records and that link in regard to healthcare and specific healthcare services. In addition, as part of as part in addition, where patients and the public can source additional literature and context, and thus and thus and thus and thus and thus in regard to in regard to neutral environs such as libraries and library services, and electronic patient record learning and electronic patient records and development. So learning and development can be taught and achieved through, for example, for can be taught and achieved through, for example, library partnerships in context of primary care health services. Um, the research poster presentation looks at and goes into sort of a little bit in regard to patient-centered multidisciplinary team meetings, or MDT meetings, in line in regard to primary care services, and in regard to and sort of joining aspects in regard to joining aspects of health literacy, to sort of inform at least some aspects of how current issues in practice or in primary care could be could be bettered or remedied. So for a long time, multidisciplinary team meetings have traditionally taken place in secondary care, where healthcare professionals in a particular specialty sort of sort of sort of join efforts to discuss sort of care plans for patients or healthcare service users. The meetings have always taken place in amongst the background and whilst it would still be a challenge to perhaps have patient-centric MDT meetings in excuse me in secondary care. This should be investigated at primary care level to increase healthcare integration and further electronic patient record awareness. And again, just to elaborate, where patients or healthcare service users having access to their healthcare records alone does not guarantee patients or healthcare service users will sort of participate or will participate in aspects of their healthcare. So whilst sorry, and what yes, and the notion or basis of patient centric MDT meetings would increase sort of knowledge and understanding of health and healthcare at various stages of healthcare, and wherein healthcare professionals within practice can and should physically involve patients or healthcare services and involve patients and healthcare service users to discuss sort of aspects of healthcare. And at the same time, there should be a call for sort of a call for works to physically involve patient perspectives and encourage each to make choices. Having access to electronic patient record alone would not help or encourage. Having access to electronic patient records alone would not help or encourage healthcare service users or patients to gain confidence and or understanding, especially if they are healthcare service users, for example, who are already overwhelmed by healthcare choices and in regard to health in regard to health literacy, healthcare and health literacy complexities. Patient-centered MDT meetings would allow sort of patient and carers to gain more electronic patient record awareness and understanding of what, for example, the tests and investigations that for example, frontline healthcare professionals request. Frontline healthcare professionals request and shared decision making may involve sort of rethinking clinical pathways to design clinical pathway sort of to design and incorporate time for information provision and care. So in this as part of this research poster presentation, a little bit about some works that took place sort of through the RPSG platform by collaborators and as part of what formed this research poster presentation as part of a healthcare awareness event in 2014. So the RPSG the RPSG, the Renal Patient Support Group, again is a non-funded social media platform which was founded in around 2009 in the southwest region of the United Kingdom. Unlike other social other particular other particular social media platforms, the RPSG also had a research active sort of remit. The RPSG had 10 or 11 members whom formed the administrative and research team, with representation from the United Kingdom, Europe, and at the time Australia and the United States, whom are responsible for moderating the social media platform. And today, at the time at the time of this research poster presentation, there have been over 5,000 members, close to 5,700 members globally, globally supporting each other, with members providing insight on lived experiences and in regard to shared decision, to help inform shared decisions. And Since the RPSG had been primarily a since RPSG had primarily been a Facebook group, this initially lent itself well to raising chronic kidney disease CKD awareness, CKD awareness. So in this works, as part of this works, all RPSG members were eligible to participate, to post comments on one particular question. And the question was, do you think that how patients should be physically involved in multidisciplinary team meetings? The RPSG had has a disclaimer which relates to research consent and requires that members are aware that they are welcome to contribute in any aspects of data collection and studies through the social media platform. If anyone feels uncomfortable or contributing, they do not have to post comments, and clear information about the works, or about this about this works was made available, and member privacy and confidentiality was protected, keeping comments all anonymized. All existing RPSG members were able to access and contribute to the particular thread in regard to the question that had been part of this works. So this now sort of highlighting some of the perspectives, that had been shared through the RPSG. And the RPSG had received in around 50 plus comments, 50 plus comments in regard to this, in regard to the question, do you think that patients should be physically involved in MDT multidisciplinary team meetings? And the research poster presentation from 2014 just sort of highlights a few comments, excuse me. So number one was absolutely yes. When wanted by patient, is possible and practical, would help answer questions immediately, rather than often wrong assumptions being made. Also means I understand better what's going on, and why particular why a particular course is being recommended. Number two, point number two, or response number two, was absolutely, I would love to be involved. I mean, it is us they are talking about, where a patient is referred to healthcare professionals, a patient referring to healthcare professionals. Number three, absolutely, quite frankly, it's frightening that we are not involved in planning our own care. And number four, comment number four, I think an MDT with patient and carer involvement would work very well for people with long-term conditions. Point number five, or response number five, education behind purpose of or objectives of an MDT to fellow patients and carers would resolve any initial hurdles, etc. Piloting can help measure feasibility and provide necessary feedback before any formal implementation. Point number six. Patient involvement at MDT meetings are essential to ensure that other comorbidities and treatments is considered, understood, and included in future plans. Unfortunately, in where this where the patient's response, where the healthcare service user's response was at the same time. Unfortunately, in the case in their case, different consultants do not communicate across to each other. And point number seven, or response number seven, was yes, 100%. Always said that. So these were just some of the comments that have been part of the research poster presentation from research poster presentation in on as part of the healthcare awareness event that took place in 2014 in the southwest region of the UK. And now, now going into sort of the sort of link in regard to developing a libraries and health partnership. Excuse me. So the need for general practitioner to work in close partnership with educational professionals was highlighted some years ago some years ago in works by an author um, an author an author referred to as or known as Robert McDonald in what had been referred to as an occasional paper number 64 from the Royal College of General Practitioners, and the publication is a publication is from 1994, where the author had said for patients to become fully interacted with their treatment and care, there needs to be a huge and sustained educational program and developed within primary healthcare. The need for patients, and sort of going on from this, the need for healthcare for patients or healthcare service users to be fully interact with treatment and care has more recently been highlighted, had been highlighted sort of 10 sort of almost a decade on in what had been referred to and published as the Oneless report by author Oneless in 2004, which estimated that excuse me, that estimated that fully interactive patients and carers were likely to help the NHS, help the NHS and the National Health Service in regard help the NHS in regard to healthcare services, and similarly the importance of supporting patient education or healthcare service user education, and when learning was also emphasized in the report, in the report, and sort of also substantiated by what had been referred to as the uh, 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 as the had been substantiated from in another report, which had been referred to from the rock from the Rockies to the Rhondda, which had been a part of the Welsh NHS Confederation in 2014. The General Medical Council, GMC, in its updated document Good Medical Practice from 2013, 13 insists that physicians must give information to healthcare service users in language and in terms that they understand. This information should relate to their conditions and treatments available, together with possible adverse effects of particular medicines or treatments and procedures, so that patients or healthcare service users following general practitioner or consultant consultations can truly give informed consent to treatments can give sorry can truly give informed consent. And this is clearly quite impossible in the time available during average, for example, a GP or primary care physician, physician consultations or appointments, which have been evidenced in amongst the literature in between anything between 7 minutes and 11 minutes. Even more impossible when the language and culture of patient or healthcare service user is not shared by the physician. In the above regard, it would also be it would be sort of it would be sensible to actively encourage healthcare and library partnerships at primary care levels, so that patients and healthcare professionals have a sort of a neutral place for educational and best use of resources. Libraries also tend to be already equipped with resources in various languages, which can aid to support ongoing care and increase health literacy. Excuse me. Library and partnerships also would allow for would allow or could allow for electronic patient record awareness, and in amongst in amongst in amongst and aligned to, and sort of linked to multidisciplinary team meetings or MDT meetings between patients and healthcare staff, which can be or could be organized in private in private areas of sort of the library a library a library library in private areas, or private in amongst private areas of the library buildings. And so now going into the the main points, my main points, and then some conclusions. So there is a requirement for general practitioners to enter in dialogue with sort of primary services, primary services in context of for example, city councils, or councils to prompt to provide to prompt in sort of in integrated services amongst primary care. Electronic patient records or EPRs need to be supplemented by decision support and personalized care planning and education from healthcare professionals, from varying healthcare professionals, which are also referred to as in amongst the literature as allied health professionals or AHPs, as well as from as well as those as well as from other varying other healthcare service providers and service users. And there is there needs to be that there should be environment where wherein patients or healthcare service users and healthcare professionals can come together to provide more awareness of electronic patient records. In addition, where patients and the public can source additional literature and context in context of healthcare service, and in regard to in regard to or as in regard to specific illnesses and specific conditions. Their patient-centered multidisciplinary team meetings would allow patients and carers to gain a sort of a more sense of awareness and understanding of what particular tests and investigations in context of laboratory medicine, for example, would actually mean. Health literacy is predominantly again a skills-based construct, and tends not to include sort of any motivational elements, and using modes to improve health literacy alone to determine the needs of patients and simplify instructions for them as a result may be a hindrance to people, thus affecting patient the healthcare service user, healthcare provider, healthcare provider a relationship. There is an ongoing requirement to support and work in partnership to increase awareness of local services in amongst in local services in amongst healthcare in amongst healthcare and in amongst healthcare, where healthcare is the underpinning or the underpinning or the basis. So at the same time, one of the sort of additional questions one of the additional questions in this research poster presentation asks what needs to happen. So by encouraging partnerships and inviting patient and public involvement, or PPI, with and amongst expertise who can effectively and efficiently add to important discussion, there is a requirement for general practitioners or primary care physicians, for example, and healthcare service users to enter dialogue with a sort of a primary care services sort of to prompt integrated or integration to prompt integration to prompt integration and to to prompt integration and to allow sort of a better understanding in regard to treatments and sort of the more broader aspects of healthcare, thus realizing the basis of expert recipients, but would also should also bring about a sort of deeper public understanding of interaction in across primary care and primary care services. So finally, now some conclusions, some overall conclusions. So given that more patients or healthcare service users and the public have opportunity to access healthcare records, healthcare records or electronic healthcare records, and libraries and health partnership can be an enhanced sort of a methodology that integrates primary care, primary healthcare better, thus allowing all to access health related literature, again sort of using books, leaflets, digital media in a setting that also has staff that can support in regard to health literacy and aspects of technology. It is the question again as part of this research poster presentation was, is it not time to integrate primary care for the better? And as part of this, part of the conclusion to inform that there must be a more unilateral thinking to ensure diversity and inclusion of different populations when developing and improving healthcare services. Partnership working can also allow reliable professional help and advice that patients or healthcare service users and the public need or require at a time that suits them, and in a language or format that they can understand and from which they can learn. Finally, an electronic patient record or EPR and MDT multidisciplinary team initiative should be supported with library and health partnerships. This needs to be or should be encouraged. That draws this audio podcast to a close, and this again, there will be a list of references or literature linked with this particular audio podcast that listeners out there are more than welcome to refer to. And this has been a audio podcast as part of a quantum edition, an audio podcast as part of a Vortux Gauntlet, is an audio podcast as part of a Lobostic sequence, an audio podcast as part of a Storm Lobostics production.